Our next recipient is working on being part of the solution through her work as the program director for the Great West Life Center for Mental Health in the Workplace. She's providing consulting services to organizations who wish to improve or address issues related to workplace mental health. These services range from individuals returning to work planning, management training, strategies that assess and address organizational mental health risk factors. She's also a consultant to Mental Health Works, an award-winning initiative of the Canadian Mental Health Association that provides training and consulting to employers. Her expertise is in the management of employees with mental health issues such as depression or anxiety, and her work includes individual return-to-work consulting, broad-based training and awareness initiatives, as well as assessment and implementation of workplace strategies to improve mental health, morale, and motivation. Her research, which has informed her approach to training, workshops, and consultation, has been in the field of innovation and empowerment in social policy. She also serves as a member of the Mental Health Commission of Canada's Workforce Advisory Committee. Ce prix souligne son engagement à hausser le niveau de l'éducation et de compréhension des maladies mentales en milieu de travail. Son leadership exceptionnel a permis d'accroître la sensibilisation quant à la fréquence de la maladie mentale à travers le pays, mais surtout parmi les entreprises. This champion was selected for an award in the private sector category for her commitment to increasing education and understanding mental illnesses in the workplace, and her advocacy has mobilized employers to take action on mental health issues because of this. And more Canadians are aware of the prevalence of mental illness in our society and in our very workplaces. Please welcome to the podium, veuillez accueillir au podium, Mary Ann Baynton.
Thank you very much. Merci. That's my French, you asked. Yes, I'm actually doing Rosetta Stone. I'm trying to learn it. I'll try again the next time I'm out in front of an audience. Thank you very much for this award. I got an email from one of my colleagues today, and she said, please don't be humble. But it's very hard for me not to be, because I know that what I do, I owe to many other people. About 2 decades ago, I know I don't look old enough to be talking about 2 decades ago, but I had a small business and I had 8 employees, and they were the best and the brightest people that I could find because I have very high standards and I wanted to have a business that really met those standards. Each of those employees had things that they were dealing with in their personal life and in their work life. Each of those employees taught me how to help them to reach their potential. It wasn't until they made me so much money that I was able to sell that business and go back to school and start a new career that I came to realize that 4 of them had a mental illness. I would have argued with you if you had told me that, because in my ignorance, I thought, like many people do, that mental illness must mean that somebody was crazy. These people were very bright professional people, but they also had things that they were dealing with, and they taught me how to help them through that. So what happened is, when I finished and I started talking to other employers, I realized that they didn't have the benefit of knowing the human being before they understood the label. And all of my work has come because I was able to listen to people with mental illness to say, this is what I need to stay productive in the workforce. And through the opportunity given to me by the Canadian Mental Health Association and Mental Health Works, and now with the many opportunities given to me to produce projects that are in the public domain through the Great West Life Center for Mental Health in the Workplace, I'm able to turn what individuals tell me will work into real products, real services, real tools and resources for employers. Many of the employers I know are like a deer in the headlight. They don't know what to do. Nobody's ever prepared them for this. Nobody has ever told them. And everything that they've learned up until that point, whether it's through an MBA or whatever their training is, didn't prepare them to be able to help someone who is emotionally distressed. And we're able to give them the tools and the resources because the many brilliant, talented people also with mental health issues can be helped to stay productive in the workforce. And what I do is simply pass on the messages that people have given me. So thank you for this award on behalf of all of those people.